Healthcare professionals across the country continue to work overtime as hospitalizations surge. Those are the physical healthcare workers. The mental health care professionals, well, they've also working overtime. It hasn't been easy on any of us to handle this pandemic. But getting an appointment to see one, at least in the state of Idaho, now nearly impossible, at least in a timely manner, because the demand continues to rise to see them. And that includes psychologists, specifically for children and adolescents. Some are developing anxiety and depression as they head back to school, and some for the first time in 18 months. Demand has gotten so high, to see a psychologist at St. Luke's Children's Hospital, you're going to need to wait at least 3 months. Katya Stepovic was able to speak with one today to get a better understanding of what is triggering some of these kids.
The division and the divisiveness is just really, really hard on our kids.
Angela Saita is a mother of 3. Her kids are enrolled in the only charter school near her that requires students and staff to wear masks.
They're excited to go to school because that is their socialization, but there is that idea of protecting the older family members in the household.
The elderly members in her household are against vaccination, and now her kids are worried about going to school and bringing the virus home, especially her 9th grader who is immunocompromised with type 1 diabetes.
He's anxious about the people that don't take it seriously because he is so passionate that he does have conversations in school about it. And it's really hard for him to not get angry with other kids' parents. He's becoming really judgmental about that.
According to child psychologist Dr. Goodmanson from St. Luke's Children's Hospital, her son's behavior is not unusual because child anxiety and depression is at an all-time high.
We continue to not be able to keep up with the demand. We were already in a bad spot before this pandemic started, and now I would say we're even less able to meet the need.
She says for a child looking to speak with a therapist, it could take a minimum of 3 months. If one needs medication, you're looking at 6 months. And for a psychological evaluation, it will be anywhere from 6 to 8 months before that can happen. And if you're thinking the pandemic has something to do with it, you're not wrong.
A year ago, there were a lot of unknowns. We were just trying to make the best decisions we could. And we were more or less all working under the same kind of rules and regulations, and the shift in terms of now the availability of vaccines for some people, the more I think increased variability of what schools are doing and what parents are requiring make that more difficult, because again there's potentially a choice point or a judgment of some sort.
She says kids are accustomed to following the rules that grown-ups tell them to. She actually sees small amounts of frustration from kids when it comes to masking, but it's more so the split opinions and opportunity for judgment that increase those anxiety levels.
It's probably more difficult if you are in a family where your school's guidelines are maybe at odds with what your family believes or thinks, and so kids pick up on that real quickly, and that can be a tension.
Dr. Goodmanson says the unknowns and the uncontrollable changes from the pandemic impact the providers too. And now more than ever, listening to one another is a must.
Somewhat new territory in that it can really make it more challenging to leave work at work and to figure out how to balance self-care with this really increased need for supporting others through these challenges.
All right, so Katya, 3 months to see a psychologist, 6 months if you need medication. That's a long time. What can parents do? I mean, that's a lot of time to kind of work it out on your own, as they say.
Well, it is. There's no doubt about that. And in the meantime, she says, if you have a pediatrician or a school counselor, make a time to see them if that's an option. But also, as hard as it may be, Dr. Goodmanson suggests trying to talk to kids about how they're feeling. And she says it's very, very hard to do, but it's important to get them to open up. And when they do, tell them that what they're experiencing is normal. This has all affected us in one way or another, and that we will, however long it will take, we will somehow overcome it, and they need to know that.
Exactly, and when some of us have kids in that age range right now, and yes, it is real. Those frustrations that they see at home or at school, they bring them home. And of course, talking about it, that's probably step one and probably the most important step to get them to talk about it in general.
Exactly.
All right, thanks, Katya.